my good friend, Dr. Dilip Sarkar. He's a retired vascular surgeon. He retired as an associate professor of surgery at Eastern Virginia Medical School, Norfolk, Virginia, and now teaches yoga therapy, Ayurvedic philosophy, and Ayurvedic yoga therapy, both nationally and internationally, to healthcare providers in USA, with a focus on integrating yogic and Ayurvedic wisdom with the science of Western medicine. He is a certified yoga therapist, certified Ayurvedic yoga therapist, yoga acharya, and an Ayurvedic practitioner. Dr. Sarkar started the first category 1 ACCME approved continuing medical education course in the USA for physician yoga therapy for medical professionals in 2010. He served on several local and national healthcare boards, including as past president of board of directors for the American Heart Association Hampton Roads chapter, Virginia, and immediate past president of the board of directors of International Association of Yoga Therapists, chair and chairman of the board of Life in Yoga Institute. Last year, he was awarded Doctor of Letters called D.Litt degree in yoga by a very well-known yoga university, SVSI in Bangalore, India. His book, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence, has been well received by the yoga therapy, Ayurveda and Western healthcare community. Dr. Sarkar and I have been conducting Patanjali Yoga teacher training workshops since 2009, and I always call him Dilip Bhai. So please, let's welcome Dr. Sarkar.
Namaskar, Shekhar.
Namaste.
Namaste. As you said, I'm a vascular surgeon, and I have seen all the practices. Jaideep ji and good friend Charlie gave it to you. So I left my slides out. No slides. I'm going to guide you to the path of COVID-19. What we have learned in last 6 to 8 months, and how yoga as a therapy is integrating in that treatment, prevention, and follow-up of COVID-19. Let's start with what is COVID-19. We call it a novel coronavirus. Novel means new. COVID, see the word COVID, CO for corona, VI is the virus, D for the disease, and 19 is, it was diagnosed in 2019. So novel coronavirus, first, we really don't know what's going to happen. So we have a panic, fear, anxiety. And then what happens, there is a group of people on us who first started denial. Hey, nothing, it'll go away. Denial gives us anger, gives us a revenge, gives us acceptance. And yoga, as you know, yoga as a therapy is the philosophy, Yoga Sutra of Patanjali. If you look at 196 sutras, of which 193 is your quieting down your mind. So the mind quiets down with yoga practice, and we will be able to handle this. Even the practice, 8 limbs of the practice, what it ends up with, yam, niyam, asana, pranayam, pratyahar, dharan, dhyan. It ends up with the dhyan, meditation. Meditation is the medication. Then we started learning it is a respiratory virus. It's a respiratory virus. It comes through our respiratory channel. It comes through our nostril. It comes through our mouth. So we practice as a yoga therapy. As you know, yoga therapy is holistic. A part of yoga therapy practice is our daily routine, dinacharya. So the practices what Jaideep ji was showing, let me tell you, I do it. All of my followers do it. Wake up in the morning, first thing in the morning, we sit down in a squatting pose in a malasana. We hold a copper glass, drink a glass of water, little lukewarm water, Ushapan. After Ushapan, I brush our teeth, I'm going to scrape the tongue. So if the virus is coming from my mouth and nostril, if there is settled in my tongue, I'm removing it, prevent it. Next, daily, I do a jalneti. So I'm doing a jalneti, not that I'm doing it when I have a COVID or when I have a flu. It is my lifestyle. Every single day, I have done it for the last 20 years. I have not missed a single day, whether I'm in the plane, I'm in the train, I'm in the hotel, jalneti. So it's washing away the viral load. Then the virus is going to your lung. And look at what it's doing in the lung. First, remember the corona. Corona is going to attach to your alveoli, the lung lining. The way it attaches, it's a little medical term, but all of you probably know about it, is through enzyme called ACE2. A stands for angiotensin converting enzyme. Guess what? All of our cardiac patients, whether it's a coronary artery disease, hypertension, diabetes, metabolic syndrome, they're all on a 4 medication called cocktail: aspirin, statin, beta blocker, and ACE inhibitor. So you are hearing that people are having more incidence of COVID-19, people have a cardiovascular disorder. So it acts through the ACE2 enzyme. But then what it creates inflammatory response. It's called a cytokine storm. We also call it present day, we call it a bradykinin storm. So a practice of yoga, as Shirley was still showing it to you, is the nitric oxide, hydrogen, and the whole practice of yoga as a therapy is your relaxation response, activation of parasympathetic tone. It is anti-inflammatory. In fact, it is anti-thrombotic. Next, what happens? Present day, we see there is a very fine studies and seeing a large number of patients that COVID-19 is creating is called a DIC. DIC called a disseminated intravascular coagulation. The blood started to clotting. One of our therapy today, when the patient comes in, we look at your blood clotting, the diagnostic test. We started them on anticoagulants. So the present concept is that it also causes thrombosis of the blood vessels, even maybe in the lung, in the heart, the rest of the whole body, and creates a tremendous amount of response. Practice of yoga therapy is anti-thrombotic. Next, the inflammation is filling up the lung, and slowly, the oxygen gas exchange is going down. One very interesting thing about COVID-19 patient is that when the patient starts to get the lowering of the oxygen, we call it the oxygen saturation, they do not get a symptom. There is a term now called a happy hypoxia. People have come to the emergency room with oxygen saturation of 70, 80, still have no symptoms. Amazing. Because the lung is like a balloon. We have a vital capacity of 4.5 liter, and normally we only breathe 0.5 liter. 80 to 90% of our lung, we have a reserve. So what we are doing in the regular yoga therapy practice, the first pranayama, you have seen all the pranayamas, but the first pranayama, you learn how to breathe out. Then you start how to breathe in, and exhalation is longer. Exhalation longer than inhalation. And physiologically, we know exhalation is parasympathetic, inhalation is sympathetic. And, during this process is there, when you get a nasal breathing, when the air is going through your nostril, you are secreting the nitric oxide from the mucosa of your sinuses. This nitric oxide then acts as a mediator of parasympathetic tone. Parasympathetic nerve is mediated through 3 substances, primarily nitric oxide, another called cyclic GMP, another called acetylcholine. So the exchange of air gets better and better because your exhalation is longer and inhalation is shorter. Then Shirley has shown how the Anulom Vilom Pranayama, Bhastrika Kapalbhati. So I'm not going to go into the practice, but let me go to the next step. So what happens in the lung, in our yoga practice, lung and heart is the same organ. Now it's going to affect your heart. Affecting of the heart, primarily today in a COVID-19, also have a direct effect on the heart. It is called your myocarditis, inflammation of the heart, and the function of the heart is going down. So what is the effect of yoga therapy in our body? The first, we call relaxation response. It's a two medical terms, but you will understand. It is called the relaxation of the peripheral arteries, reduction of the called peripheral resistance, and it is called the reduction in the afterload of the heart. That means heart can function little better when you are practicing yoga therapy. Also with the pranayama, what you do, it is called the retard of the heart, the blood coming through your lung is more. It is called a better preload. I'm going to finish in a few minutes, but before I tell you, look at the sequence of COVID-19, what happens. Inflammation in the lung, then it's going to affect in your heart. Then it goes into the phases, it's called the septicemia. The infection has gone to the blood, and infection in the blood is called septicemia. Then it creates a phenomenon called a septic shock. Now your blood pressure started coming down, your body perfusion coming down. You started having a phenomenon called multi-organ failure. Then you develop a kidney failure. If you have a liver failure, it is the end of it. So what is the ultimate effect of yoga therapy of your COVID-19? So look at a scenario, a person who is dying. The person who is dying, we say expired. Means his last breath has come out. When the lung stops, then the heart stops. When the heart stops, then the brain stops. When the brain stops, all the cellular function stops, and the person is dead. So on the other hand, in the yoga practice, what you're doing, you are improving the lung function. When you're improving the lung function, you're improving the heart function, improving your brain function, improving your cellular function. So it is as simple as it is, but the most important practice is what yoga as a therapy means, the adaptation of the yoga practices. We use the same Yoga Sutra of Patanjali. We're using the same Patanjali Ashtanga Yoga, but we learn how to use it and make an adaptation on the person's or patient's clinical condition. So today we are seeing that as a prevention, as an integrative medicine, where you need a supportive therapy, you do. And even post-COVID, the practice of all this thing, Jaideep and Shirley are showing it to you, are excellent in a part and parcel, and we are using it every single day in our practice and in our teaching. Thank you for your time, and we'll be glad to answer any question.
Thank you, Dr. Sarkar. What a wonderful way to tell us in a very basic language we can understand what's going on and how these yoga practices can work our lungs, heart, our brain, and the whole body. You know, you combine Western medicine with yoga, Ayurveda, and as a representative of Patanjali YogPeeth here, I get so many questions from so many people. And Dr. Sarkar is the first one I go to. So thank you so much. Q&A sessions. All participants who wants to ask the questions, they can click on the participant link, and there you will see on the right side of your window to raise hands, and we can see the raise hands, and we can unmute you to ask the questions. And There are some questions we have received through the
Shekharji, you're muted. Shekharji, you have to unmute yourself.
Yes. Okay. All right. Now, can you hear me? Yes.
Yeah.
Okay. Sorry, sir. Yes. So we are. Thank you for all our distinguished speakers. Now we are to the Q&A session. The participants in the Q&A, they can click on the participant mark, and on the right side of their window, you will see the raise hands, and we will recognize your raise hand, and we will unmute your speaker. And we have received some questions through our chat box here, as well as through the Facebook. And I will read some of the questions here. People are asking, do we have Patanjali products available in United States? Yes, there are many retail centers, and I know of one in Atlanta. You can Google there, go to their website, ramdevproducts.com. They carry the most number of products I know of. And is Coronil available in USA? I understand they have it also. Giloy is recommended for anybody on a daily use, whether you are suffering from COVID or you are healthy, to avoid any kind of chance to get COVID. It's a very good immune booster. And then we have some questions. I would point this to Dr. Telles. Can Kapalbhati induce blood pressure? By Leena Ektare. Ashok ji ask, pranayam karne se sir dard ho jata hai, that doing pranayam causes headache, and that I would request Dr. Sarkar. And there is another question to how to control pitta, and Dr. Jaideep ji, with his background, can also answer that question as I get started with these, and I will find many more questions for our distinguished speakers. And Dr. Sarkar, regarding the pranayam causing headache.
Okay. So first of all, we practice what is called the yoga as a therapy, yoga therapy. A whole yoga therapy practice is a relaxation response, activation of parasympathetic tone, and listening to your body's signal. We really is not going to compete with anybody. So for the Kapalbhati Pranayama, when you are going to do, we really don't go and sit down on a chair and start doing a Kapalbhati Pranayama. First, what we do, we teach you how to able to sit down with your spine straight, how to able to do a asana called Sthiram Sukham Asanam. You do the Sukshma Vyayam, you do the relaxation of your shoulders, relaxation of your neck with a Brahma Mudra. And once you're relaxed, then we listen and look at your breath. What is your breath? Annomaya kosha to pranomaya kosha. Any imbalance you create in your physical body, it shows up in your breath. So your breath is completely effortless. Exhalation longer than inhalation. At the beginning, you may able to do about 30 seconds. It's okay. Stop it, because it is phenomena called a neuroplasticity. By the practice, what is called a habit, you will develop more and more. That's how we started. We started from nowhere, and look where we are. What happens is that as a medical personnel, we know if you keep on doing any breathing, little faster rate, whether it is a Kapalbhati Pranayama or a Bhastrika Pranayama, you develop a phenomena called a hyperventilation syndrome. In a hyperventilation syndrome, you have a tremendous amount of symptoms. You had an altered sense of consciousness, you have a cerebral vasoconstriction, you have the sarcomoral numbness, carpopedal spasm. So you may have a headache. Any symptoms you get in any pranayama practice, my request is that you start doing slowly, start doing effortlessly, start doing after relaxing your physical body as if the whole practice is your savasana, whole practice is a normal, effortless breathing. And how do you know? You'll be able to talk, you'll be able to sing when you are doing a pranayama practice, and guaranteed you're not going to have any symptoms from the practice of pranayama yoga as a therapy. Thank you.
Maybe Dr. Sarkar may add something at this point, and then I could still say my ideas about how yoga could help for these two possibilities, if that's all right.
Okay. Question came from Vimala. Vimala, thank you. She's from Trinidad, and she's always in touch with me. Yes, Shekhar, you know her too very well.
Yes.
Okay. Vimala, you've been positive for 4
host.
months. Yeah, she was our host. You've been positive for 4 months. So the possibilities are, the first, what test you have done. There are 2 tests. Remember the virus, one has a surface antigen, and then it is actually a RNA virus, it's called a messenger RNA. In fact, that is RNA being used for making the vaccine. So PCR test. The antigen test is very quick, but reliability is a lot less. There's a very high degree of false positivity. And the other test, which we are looking at the particles of your virus, but the test itself now determined, called a viral load. This is a new word is coming up, and this is the thing we learned in last 6 months. Based on the viral load, you may even need to be treated in an asymptomatic patient. So for example, our President of the United States got positive, and I don't know if you know all of it or not, he got a monoclonal antibody. He got a monoclonal antibody in addition to the antiviral drug. Why? That monoclonal antibody is only given when there is a high viral load. Now it has been showing more and more, even what CDC is recommending, that if you being a positive with even a high accuracy COVID-19 test, if you are asymptomatic, listen to it. This is the CDC's recommendation, and they are again doing back and forth. After 10 days, being asymptomatic, you don't need to do anything. So, Vimala, if you're asymptomatic, you'll be fine. You don't go and keep on doing the test repeatedly. Same as for Shekhar also. Shekhar looks so good. Shekhar, I don't know why you went and got another test. This is the CDC recommendation now.
It was at our Arya Samaj, so we went to support them too. And
okay. Next thing what you need to know and learn, I'm sure we have a lot of physicians here, we know, that all of the knowledge we have of the virology and the knowledge we have as a public health, everything has failed with a novel COVID-19. So what happens, we are learning every single day. If you look at like a New England Journal of Medicine, is a Bible of medicine, 80% of the articles now on COVID-19, I'm reading all of them, looking at it. So coming back and back and back, please, if you are asymptomatic, if you are not in a healthcare provider, or if your job does not require to be tested. CDC is recommending now not to get tested. Remember, the testing is called the prevalence. Prevalence means you take this group of people, you want to do a test to see how many percentage of people has a positivity. But most of the things are done today now is that if you get a 1 positive, if you're asymptomatic, after 10 days of quarantine, you don't have to do anything else. And the positivity rate is primarily due to called a viral load.
Thank you, Dr. Sarkar. Wonderful. We are already past our scheduled time, but I want to say many people are asking if these presentations will be available. We would request our speakers, and we will put it on our Facebook page, please. And we'll take the last questions here from Yogacharya Lalit Kumarji. I'll unmute you and you please ask your question. Thank you for joining us.
Thank you, sir. My question is, as a post-COVID symptom, that's a very common thing, is loss of smell. So what are the suggestions as a yoga therapy for the same?
Dr. Sarkar, you want to take that, please?
Yes. So, smell, if you can look at loss of smell, it is obviously, we call it a neurological function. But from the yogic standpoint, it is our pancha indriya. We have the 5 senses, and we are able to create a yogic practice which really improves the function of our 5 senses. So what is the important thing about the 5 senses is, then the yoga says that if you try to create a phenomena of which you get the frequencies of the brain and the frequency outside, it interacts, it clashes, and it's called a harmonic resonance. So this is a practice we call a Bhamri Pranayama. We recommend a Bhamri Pranayama for people who have some so-called loss of smell and some other unusual. We are seeing a lot of people having a DVT and the numbness in the leg post-COVID. So we'll do a Bhamri Pranayama, and the whole mechanism of Bhamri Pranayama is you shut down your 5 senses, then you create a vibration, which vibration probably has some relation to the vibration of your brain. 2 vibration interacts, cancels, called a harmonic resonance, and you are getting some improvement of the pancha indriya. But one thing you have to remember, that whole yoga therapy is not a reductionist, it is a holistic practice. So we really do not recommend you to just keep doing a Bhamri Pranayama daily to get better of your symptoms. You have to do a daily practice, daily practice, daily practice. You incorporate a little bit more of these practices based on your symptoms. Thank you for the question.
Thank you very much, Dr. Sarkar. With this, we will conclude today's session. I want to thank everyone to join us here on this Zoom call, as well as on our Facebook page. Special thanks to all our distinguished guest speakers, Dr. Jaideep Aryaji, Dr. Tellis, Dr. Sarkar, and Dr. Narayanaji. Also, my sincere thanks to Brij Kambojji, Tanvi Shahji, Somas Agarwalji, who are working in the background to make sure everything goes well. I think the session went very, very well. I ask everyone to stay safe, stay healthy, do yoga on a daily wise. Karo yog, raho nirog. Thank you very much. May God bless you all. Namaste. Om.
Om.
Thank you.